I'm Lara. I'm the clinical manager at the VNA of Manchester in Southern New Hampshire. I am a nurse and I have been working in hospice for 20 years. So some of the challenges that I've noticed over my 20 years of being in hospice when people are navigating their care at the end of their lives is that they really don't understand what is available and what isn't available. We try to put together a plan to care for them the best that we can. Hospice is 100% covered by the hospice benefit. Medicare pays a daily rate to the hospice program, and out of that daily rate is we provide the nurse, social worker, chaplain, home health aide, supplies, medications, equipment. So it's basically one-stop shopping, and it just makes it a lot easier for the person who's at the end of their life and their family. The hospice team consists of a nurse, social worker, chaplain, home health aide. We also have volunteers, as well as, of course, our medical director. We all have different roles. The nurse is the person, the eyes and the ears for the physician, essentially. They go in and assess the person that's on hospice, make sure that they're comfortable. If they're not comfortable, we'll collaborate with our medical director and get orders for different medications to ensure comfort. The social worker is available not only for emotional support for the patient, but also for the family. Our nurses are really skilled at knowing what patients and their families need, and if they're seeing that they're in need of spiritual support or emotional support, they will definitely recommend having the social worker or the chaplain come in to make a visit. And the home health aide provides personal care, so we'll help with a bath, can help feed the patient if they can't feed themselves. They can tidy up the house. It's very helpful. The volunteers can do whatever brings the patient on hospice joy. If they like to play cards, if they want to play checkers, if they like reading but they can't read anymore, they can be read to. Our volunteer program is very extensive and has a lot of different wonderful things for the patient and the family. So in hospice, we have different benefit periods. The first 2 benefit periods are each 90 days, and everyone thereafter is 60 days. And within each benefit period, we will pay for 5 days of respite. And respite is so that the family or the caregiver who's been caring for the person that's on hospice can have a break. And we contract with a number of nursing homes in this area, and we work to get the person on hospice to the nursing home so that they can stay there for 5 days. So they'll be cared for by the nursing home staff as well as the hospice staff. One of the many benefits of hospice is that we provide bereavement support to the family for 13 months after the person that was on hospice passes. And that can include one-on-one bereavement support, can be phone outreach. We have bereavement groups. We try to make it as easy as possible for the person that's on hospice and their family. I would recommend to people at any stage in their lives to think about what their life might look like at the end. Do they have loved ones to care for them? Do they have the finances to pay for someone to care for them in their home if that's where they want to stay? Or do they have the finances to pay for care in assisted living or a nursing home? It's not something that we typically think about, but when you get there and you don't have these things planned, it can be a big challenge. We often run into family members saying, "No, I don't want that for mom yet." And what I always ask is, what don't you want for your mom? This care is free. We're providing nursing and emotional support and spiritual support and physical support, and it's for free. And there's no obligation. When a person signs on to hospice, they're not obligated to stay on hospice. If they decide that this is not the level of care that they want, they can say, "I don't want this anymore." If they decide they want to go to the hospital, they can go to the hospital and they just sign off hospice. There's no penalty to that. They can come back on 2 days later if that's what's needed. So I think people think, oh, this is it, this is a death sentence when they sign on to hospice, and it really, really isn't. It's about having the best quality of life that you can possibly have for the life that you have left. The difference between hospice programs is probably the people. I do believe that everybody who works in hospice is called to do the work. So I can only speak for my team at the VNA of Manchester in Southern New Hampshire, and they are the most devoted, dedicated group of people I have ever known. It almost brings me to tears to think of how much of themselves they put into their work and their patients families. I really can't think of any downside to signing on to hospice. If you're at the end of your life and you want to stay home, you want to experience comfort, joy, and dignity, it really is the best choice, because that's what our goal is for you.